And we did a PRP treatment with you. It's been almost 2 months now. So let's start with just telling us again about the back pain problems that you had, when it started, you know, the kind of things that you've done. So just start with that.
Okay, my back pain started more than 50 years ago. I think that the first break that I've had in my back was during childbirth, and that was with my last child 46 years ago. I've had injuries. I have had injuries to my back since that time. He has 2 spondylolisthesis back there, and that means my back is moving back and forth and side to side as well. Plus, I have a very narrowing canal, as they tried to do a spinal tap when I had hip surgery a couple of years ago, and the canal is so small that they can't even get a needle in it any longer. So I've had a lot of back pain for the last 50 years and been on ibuprofen twice a day for over 30 years to be able to function. Doctors would like me to take more of a narcotic, but I don't want to take a narcotic, first of all, because I'm an RN. I work in the field, now in hospice, but I can't take those kind of medications and work, and I don't like the feeling of them. They're just bad for my body, and I know it. So I've done all kinds of different measures to get relief from my back pain. I've been going to a pain clinic. They've been doing steroid treatments in my back. They've been doing nerve ablations, trying to kill all the nerves so that I can move without as much pain. I've had I am taking a muscle relaxant, but I noticed that I'm really not needing them as much. The pain that is worse at night than during the day, actually. And my biggest problem is sleeping, because the minute I start laying down, I get spasms from my back down to my toes. My feet feel like there are tourniquets around them. It's very hard to move. It's very painful, and sometimes if they're so bad, they've actually thrown me out of my bed.
So since you've had the procedure 2 months ago, what have you noticed that's different, the improvements?
I noticed quite a bit of difference. It's really surprising to me. Just little things that I've noticed. For instance, we were discussing stepping up on a curb, because for a long time I couldn't step up on a curb without feeling unstable. Walking downstairs, I have 3 or 4 stairs at my house that I have to walk up or down, and I would have to hold on using one leg. And there are times when I still have to, but for the most part, I can use both feet and go down the stairs like a normal individual at this point in time. I've noticed much less spasm at night. I still have the problem. I still have the feeling like there's a tourniquet on especially on my right leg, but that moves side to side. So sometimes it's on my left, sometimes on my right. But overall, I think it's at least 60% improved at night. That is a big thing, because sleeping is something I wasn't doing.
Okay, and then how often are you taking the ibuprofen now?
I've taken it maybe 5 times since the last procedure, in the last 2 months.
Okay, and before you were taking it twice a day, every day?
Twice a day, 600 to 800 milligrams twice a day for 30 years.
Every day?
Yes, every day. Every day without fail, because I could not walk. I could not get out of a chair without taking it. Oh, I did my first mile.
Oh, really?
Walking the other day. It was not easy. My legs still feel heavy. You know, like, oh my gosh, I got to lift them. They feel very, very heavy. But I wasn't having back pain, and it's just going to take me more time. But I'm very excited to start doing 5Ks again, maybe one day. That's my goal.
So before the procedure, how far could you walk before you had to stop because of pain, or?
Not more than 5 or 10 feet.
Okay. And now you can walk a mile without pain?
I can walk a mile without pain, but it takes me a while. I have to stop every little bit.
Is it because of fatigue or like muscle weakness?
It's muscle weakness and fatigue, and my legs feel really heavy.
Okay. So overall, how much improvement would you say you've had?
I think overall I've had probably about 70% improvement.
Okay, great. And that's just with one treatment?
Yes. Especially since I haven't had to use ibuprofen or what have you, just to be able to feel like I can get up and move and do what I need to do.
Yeah. All right, great. Thank you very much.
You're welcome.